From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
Back at 10:53 on this Friday morning, March is Colorectal Cancer Awareness Month. Colorectal turns out to be the third most common cancer in men and women. I beg your pardon. Dr. Gupta is with the Associates in Radiation Oncology, and she is live with us here in the studio right now to talk about a number of different things, including early screenings and treatment here. But the first thing I want to talk about, Dr. Gupta, is sort of the veil that gets put over colorectal cancer. It's something that people don't want to talk about. They don't want to think about. Avoidance is so much of a problem here because, and we'll talk about this in just a bit, this is actually a pretty good news story, as it turns out, when it comes to you've got some very effective treatments. If you find it early enough, 5-year survival is very good. But it's just getting past that sort of initial, it's a thing I just don't like to think about. How do you do that?
Right. You know, we have multiple screening tools and tests for a variety of malignancies, and colorectal cancer seems to be the one that nobody, as you said, wants to talk about. So in terms of screening, we know that colorectal cancers, first of all, colorectal cancers of the colon and the rectum, obviously. And when we talk about colon, there are multiple segments to the colon. And in terms of screening, colonoscopies are probably the best screening tool that is available. Now,
we're actually looking at some video of one of those exams right now.
Right. So a colonoscopy involves inserting a tube into your colon to get images and pictures of the colon. And it is something that is fairly invasive. It can be uncomfortable and does require some preparation work as opposed to other screening tools that we have. So there's a little bit of I think there's a little bit of fear associated with it because of that. And
it's the same sort of reluctance, too. Again, it's an unpleasant subject. I don't want to have to think about it. And if I actually have to do something in preparation for this test, I'm not sure I want to do that.
Right.
But here's what you have to think about, it seems to me. You do that, which is a relatively insignificant thing, and you know whether or not you have a cancer that can kill you.
Correct. And colorectal cancer is one of the few malignancies that early stage disease generally does not produce symptoms. Whereas where you finally get to the point of having rectal bleeding or having change in stools, things may have progressed. So
then you may.
Important.
Yeah.
The advantage to colon cancer screening, frankly, is that unlike the other malignancies, screening doesn't have to be done annually. Depending on what kind of risk factors you have, it's once every 5 years. So it's not your mammogram that you got to go in for every year, or your PSA, or any of those things.
And here's the carrot at the end of this stick, if you will. The fact is that you've got some very good treatments, you've got some very good procedures that can be done, that people who have had colon or rectal cancer can be treated and can live long and happy lives afterwards.
Early stage disease carries a very high cure rate and survival rate and is generally treated, for colon at least, with surgery alone. For rectal cancers, treatments can get a little more involved with such as what I do, radiation treatments, chemotherapy, but still early stage disease tends to carry a very long survival rate to it.
The take-home message here is there are good tests available. We need to take advantage of them, and lives will be saved as a result. Dr. Gupta, thank you so much for joining us again.
Well, thank you.
Good to see you. We're going to step away for just a bit. At the top of the 11 o'clock hour, back with more news. We invite you to join us.